Diabetes is a chronic disease. This happens when the pancreas does not make enough insulin, when the body cannot use the insulin produced effectively. Insulin is a hormone that regulates blood sugar. Hyperglycemia, or elevated blood sugar, is a common effect of uncontrolled diabetes and, over time, leads to serious damage to many systems of the body, especially nerves and blood vessels. In 2014, 8.5% of adults 18 years of age or older had diabetes. In 2019, diabetes was the direct cause of 1.5 million deaths, and 48% of all deaths due to diabetes occurred before the age of 70. Between 2000 and 2016, the premature mortality rate from diabetes before the age of 70 increased by 5%. In high-income countries, the premature mortality rate due to diabetes decreased from 2000 to 2010, but then increased from 2010 to 2016. In lower middle-income countries, the premature mortality rate due to diabetes increased across both periods. By contrast, the probability of dying from any one of the four main non-communicable diseases, cardiovascular diseases, cancer, chronic respiratory diseases, or diabetes, between the ages of 30 and 70 decreased by 18% globally between 2000 and 2016. Type 1 diabetes. Type 1 diabetes is characterized by deficient insulin production and requires daily administration of insulin. In 2017, there were 9 million people with type 1 diabetes. The majority of them live in high-income countries. Neither its cause nor the means to prevent it are known. Symptoms include excessive excretion of urine, thirst, constant hunger, weight loss, vision changes, and fatigue. These symptoms may occur suddenly. Type 2 diabetes. Type 2 diabetes results from the body's ineffective use of insulin. More than 95% of people with diabetes have type 2 diabetes. This type of diabetes is largely the result of excess body weight and physical inactivity. As a result, the disease may be diagnosed several years after onset, after complications have already arisen. Until recently, this type of diabetes was seen only in adults, but it is now also occurring increasingly frequently in children. Gestational diabetes is hyperglycemia with blood glucose values above normal but below those diagnostic of diabetes. Women with gestational diabetes are at an increased risk of complications during pregnancy and at delivery. These women and possibly their children are also at increased risk of type 2 diabetes in the future. Gestational diabetes is diagnosed through prenatal screening rather than through reported symptoms. Simple lifestyle measures have been shown to be effective in preventing or delaying the onset of type 2 diabetes. To help prevent type 2 diabetes and its complications, people should achieve and maintain a healthy body weight, be physically active, doing at least 30 minutes of regular, moderate-intensity activity on most days. More activity is required for weight control. Eat a healthy diet, avoiding sugar and saturated fats. Avoid tobacco use. Smoking increases the risk of diabetes and cardiovascular disease. Early diagnosis can be accomplished through relatively inexpensive testing of blood sugar. Treatment of diabetes involves diet and physical activity, along with lowering blood glucose and the levels of other known risk factors that damage blood vessels. Tobacco use cessation is also important to avoid complications. Interventions that are both cost-saving and feasible in low and middle-income countries include blood glucose control, particularly in type 1 diabetes. People with type 1 diabetes require insulin. People with type 2 diabetes can be treated with oral medication, but may also require insulin. Some types of diabetes, like type 1, are caused by factors that are out of your control. Others, like type 2, can be prevented with better food choices, increased activity, and weight loss. Discuss potential diabetes risks with your doctor. If you're at risk, have your blood sugar tested and follow your doctor's advice for managing your blood sugar. I hope this video will help you the most. If you like our video, don't forget to subscribe